Almost every day in my clinic, I see patients for a consultation regarding ovarian cysts, and this can be a very stressful diagnosis because it's hard to know when to worry. There's a fair amount of misconceptions out there regarding ovarian cysts, and it's hard to know if the information you're looking at really applies to you. So my hope is that I can help answer some of these questions in this video series. Welcome back to another series. We're going to be talking about ovarian cysts. Now, I haven't come up with a catchy name like Fibroid Fridays yet, but hopefully we can assist you in finding out about ovarian cysts. It's really important to understand the background and the physiology behind the ovaries and how these cysts develop to really understand the treatment going forward. I like to start out my consults when I'm talking with somebody about ovarian cysts by first giving a lot of reassurance because number one, ovarian cysts are really common. They're a normal physiologic mechanism of the ovaries. Very rarely are they anything like cancer or something to be concerned about. And they often may not even need treatment, just watchful waiting. The ovaries and the follicles within them rely on a very precise set of signals to develop normally and to release and ovulate. And so it's normal for every cycle a cyst to develop on the ovaries, and we usually call these follicular cysts. And if everything goes to plan, what happens? These follicles develop, the cyst grows, ovulation happens, the ovum's released, goes down the fallopian tube in the uterus, and whether or not fertilization occurs, the cyst, what develops into the corpus luteum, then resolves. Again, this doesn't always go as planned. And so if ovulation doesn't happen, then that cyst may persist and stay around for a little while. Potentially, if it continues to get a little bit of an abnormal signal, could even grow larger. I think this is probably a good point to talk about, well, how do we find these cysts? A lot of times they're incidentally found, meaning someone doesn't have symptoms. But sometimes if the cyst grows large enough, it can have some symptoms of pain. The best way to identify cysts, just like fibroids, is to do a pelvic ultrasound. It's a lot better than doing a CT. It can allow us to see the characteristics of that cyst that helps us to know what type of cyst it is. So if someone goes to the emergency room because they have pain, they get a CT scan, they notice that there might be a cyst on the ovary. We like to do an ultrasound then because that gives us a better view. On rare situations, we might want an MRI to help us further characterize this cyst. But few of the terminology terms that we use help us to determine whether or not we should be concerned about this cyst is its size. And so we measure it, usually in centimeters. The next thing we look at is, does this cyst have anything in it? Or is it just kind of like a little balloon with clear fluid in it? That would be called a simple cyst. Having a simple cyst is generally a very reassuring thing. Just normal fluid within a cyst that grew too large. Now, if something is a complex cyst, that means there's things in the cyst, whether that's things like bloody fluid or endometriosis type cysts might have that, or dermoid cysts, where there's things in it. Generally, a lot of these cysts are still very benign, but is a sign that maybe we want to investigate it further. Another thing is cysts can be septated, meaning there's dividing lines within the cyst or loculated parts of the cyst, or if there's other solid components of the cyst, we might make note of that on the ultrasound. So in the first segment, we talked about these cysts that are developing just by abnormal signals and develop on the ovary that are called physiologic cysts or follicular cysts. That would be the first type of cyst that we described. And we also talked about corpus luteum cysts, how when that ovulation happens, that leftover cyst forms a corpus luteum. Both of these are extremely normal, and often these are the type of cysts that resolve. Now, a hemorrhagic cyst is often something that we see a lot, very common, and again, benign. It's usually one of the first two options that we described. However, one of the blood vessels breaks, blood flows into that cyst cavity. It can be very painful, and that cyst usually will still rupture like normally, and some of that blood within the belly can be irritating for even days following the acute event. Now, this does happen a lot where if someone goes to the emergency room, they're found to have a ruptured cyst. Usually it's this hemorrhagic type cyst. And again, it's very rare that they need any additional interventions such as surgery. Usually the body will heal these on its own. Another type of benign cysts is what we call is the ovary dermoid cysts or mature cystic teratomas. Now, these are the cysts that you might see on Grey's Anatomy where they can be kind of medium to large type cysts, maybe baseball size, potentially larger. They generally don't cause symptoms. And so they're usually an incidental finding. They can very rarely cause symptoms or twisting, or if they're big enough, they can push on structures around them. But these cysts, they are quite unique because they have those fatty material in it. They have hair material in it. They might even have calcifications that might look like something like teeth. And so that's why I say these make the news or the Grey's Anatomy type shows, is because they can be quite interesting. But again, they're benign. We'll get a lot more into the treatment of all these cysts in future episodes, but these cysts generally don't go away on their own. But it's extremely rare that they do anything like rupture. Now, we haven't really talked about endometriosis yet on this video or the podcast, and it's a big goal of mine to do that here in the near future. But endometriosis within the body wants to wall it off because it's very inflammatory. The body doesn't want that within it. And so when it's on the ovary, the body walls it off, but that endometriosis still continues to proliferate and grow and forms what's called an endometrioma, or a collection of that endometriosis. We usually find these in patients who have very painful menstrual cycles. So if somebody is having really painful menstrual cycles, this is one of the reasons why I say go in and get evaluated, is because maybe something like endometriosis or endometrioma could be potentially causing that, and there is a fix for it. We'll talk more about endometriosis and endometriomas in future videos and podcasts here at the New School OBGYN. Certain imitators of ovarian cysts would be things like hydrosalpinx, which is a dilated fallopian tube, on ultrasound or other imaging can look like it's coming from the ovary. Other things could be an abscess, whether this is from things like the diverticulitis, which is again by the ovaries, from something like PID. Those abscesses can be on the ovaries. The fallopian tubes can have cysts, and everything, fallopian tubes, ovaries, bowels, they all touch each other, so it could look like it's coming from the ovary. Sometimes even pedunculated fibroids, which we've talked about before, can look like they're coming from the ovary if they're touching. The big question with all of this is, when should somebody be concerned? And so this is kind of the art of it, is really figuring out someone's risk factors for something like a cancerous type cyst. And there are a number of things that we take into account to see if our suspicion for something like a cancerous cyst is high or low. This is generally, first number one is the age of the person that's coming in that has the cyst. If somebody is before menopause and they have a cyst, this is extremely common. If it looks just like a simple cyst, meaning again, fluid-filled cyst, this is generally almost exclusively benign. And when there's other cysts there, like the ones we talked about already, again, extremely likely that it's benign. If someone is after menopause or has additional risk factors, or if somebody has genetic cancer syndromes, our suspicions would be increased. We might do something like blood tests, like a CA-125 or other blood tests, to see if this cyst has a higher chance of being cancerous or not. We're going to go through a lot of different things about ovarian cysts here in the upcoming episodes of this series. We're going to go over the different management options that you have depending on what type of cyst you have. We're going to go over the possible ways you can prevent ovarian cysts. We're going to go over what should someone do if they're pregnant and they have a cyst. And of course, we'll talk about the different management options, including surgery. Again, to recap this episode, ovarian cysts are very common. If you are diagnosed with one, please see us, see your OBGYN, so they can start the workup to see whether or not you should be concerned about your cysts, or whether or not time may heal this, or if someone needs additional interventions for their cyst, if it is something like a dermoid or an endometrioma. Once again, thank you everybody. If you got this far, please give us a like, please give us a subscribe. It matters a lot to us. It gives us a motivation to continue to put out a lot of this free information out there to the public, because here at the New School OBGYN, it matters a lot that you get reliable information. I hope everyone has a great day. We'll see you soon. It'll come to me, but maybe we'll assist you. That was bad.